From the Detroit Free Press, it's Monday, January 11th. Here are today's top stories. Presented by Bush's Fresh Food Market. Bush's has over 4,000 Michigan products, including the freshest fruit and vegetables, meat, seafood, and baked goods. Stop by one of Bush's 16 locations for the personal service you expect from your neighborhood grocer.
For the Detroit Free Press, I'm Kerry Jr. II. Last week, Governor Gretchen Whitmer announced that individuals who qualify in Phase 1B of Michigan's vaccine rollout plan can sign up today. Michigan has not administered half of the first batch of vaccines, but Whitmer says delays with the federal government are making things worse. As always, Kristen Jordan-Shamus with additional details. Kristen, thanks for joining me. How has Michigan been faring in the distribution and administration of vaccines?
So it's not just health departments that are administering these vaccines right now, it's also hospital systems. And the hospital systems are mostly taking care of their own workers. And then also other workers who might not be affiliated with that hospital system but still need a vaccine, they can also go and get one. In addition, those first responders, like those emergency medical people, those firefighters, those EMS folks, they're going to health departments to get vaccinated. And the federal pharmacy partners like CVS and Walgreens, they're supposed to be handling the nursing homes. If you just want to look at the data and say, well, gee, how is Michigan doing? And how is Michigan doing compared to other states? If you look at the state's COVID-19 dashboard, it shows 725,000 doses, right about there, have been distributed in Michigan. But just under 200,000 have been injected into the arms of Michiganders. So there's at least 500,000 doses that are sitting in freezers somewhere unused. Governor Whitmer said that health officials are working just as hard as they can to get these vaccines out, but it is going to take some patience and it's going to take some time. And the other thing to remember, too, is that health departments have to build online registration platforms to sign people up for vaccine appointments. And they're creating these websites and registration systems, in some cases, from scratch.
Just Wednesday, the governor announced that we were going to move into Phase 1B. How does that impact the process moving forward in terms of whether or not they're prepared to enroll so many people, but also whether or not we have the vaccines available to administer to them?
Yeah, so this is a really big challenge. And a lot of local health departments are saying, look, we can't even get enough doses of the vaccine to immunize the people who are in the very first priority group, 1A. We don't have enough vaccines to get all of our emergency medical workers, all of the healthcare workers who aren't affiliated with the hospital system who need to be vaccinated. We don't have enough for them. And they're saying it's just going to be a long wait at this point for the 1B priority people if they don't get some more supply and if they don't get some help.
Hospitals, they're also playing a bigger role in terms of, getting vaccines administered to vulnerable populations. Can you talk a little bit about that?
Yes. So Michigan Medicine, Beaumont Health, and Henry Ford Health System all announced Thursday that they were going to vaccinate their patients who are senior citizens ages 65 and older. And that is going to take a tremendous burden off of local health departments to get those people vaccinated. These are folks who already exist within those hospital systems' record systems. They can communicate with those seniors very easily. They can let them know how to schedule an appointment electronically through their, electronic messaging systems. And they can get that process started in a much faster and more efficient way than a local health department with very limited vaccines can do. And so they were going to start that vaccine process starting Monday. And St. Joseph Mercy Health System is also going to be vaccinating its senior citizen patients starting next week as well. So that really does take a big load off of the health departments. And the feeling and the thought is that probably a lot more health systems and hospitals are going to start doing the same. Seniors are going to start getting email messages within the next couple of days, if they haven't already received email messages from their hospital systems telling them, you can go online and you can schedule an appointment. And one of the things that we saw on Friday was that some hospital systems' electronic record systems, like their MyChart programs, were overwhelmed with the flood of patients who got those emails that said, you can go ahead and register, and it crashed their systems. What hospital systems are also saying is, we can't all rush the system at once. We won't have enough doses to give those vaccines to you immediately. Please don't call us because we don't have a phone system set up to handle all those calls.
Thanks, Kristen, for your time.
Thank you. Take care.
The governor said teachers and school workers are eligible to enroll for the vaccine today in an effort to resume in-person learning in March. As of Saturday, the state health department reports 2,700 cases of the coronavirus and 222 deaths. The state averaged over 3,000 cases and 108 deaths over a 7-day period. In total, the health department has reported over 519,000 cases and over 13,000 deaths since March. For more information on COVID-19 in Michigan, go to www.freep.com.
I'm Kirkland Crawford with the Free Press Sports Department, peeking in on the Detroit Pistons. And man, the season is getting longer and longer for the red, white, and blue. On Sunday, the Pistons lost 96-86 to the Utah Jazz at Little Caesars Arena. The Pistons fell to 2-8 on the season, and that's already tied for the most losses in the league. But all is not lost on this season. Two things to watch for. Number one, the emergence of Jeremy Grant. The forward signed with the Pistons in the offseason after a quiet start to his career, but he's now playing at an all-star level. He had 28 points Sunday and has scored at least 20 in every game this year. And the second thing to watch for, the draft lottery. At this rate, the Pistons will have the best odds to land the number one pick in this year's NBA draft, which promises to have some high-level prospects, starting with Oklahoma State freshman Cade Cunningham.
For more stories from the Detroit Free Press, be sure to check out freep.com. That's FREEP.com. If you're a fan and want to support our quality local journalism, subscribe. Go to freep.com/special offer.